According to the Heart Association, 1 in 3 people over the age of 60 is living with a condition of latent heart failure. No obvious symptoms, no sudden chest pain, but the heart has already begun to lose its ability to pump blood effectively. And what worries the professionals the most isn't that number, but the complacency that comes with it. Most patients still believe they are completely healthy until their hearts speak up. As a specialist who reviews hundreds of elderly patient records each year, I've noticed a frightening commonality. Most cases of heart failure don't result from trauma or major events, but from the heart being quietly worn down by every poor meal, every nutrient-lacking choice. The heart muscle weakens due to a lack of good protein, blood vessels harden due to a lack of healthy fats, heart rhythms become unstable due to missing minerals and vitamins essential for electrical regulation, and all of it happens in silence. After the age of 60, the heart no longer adapts as well as it used to. At this stage, medication or rest alone isn't enough. What's needed are essential nutrients that nourish the heart from within. Unfortunately, many still believe that eating normally is fine. But what's considered normal by old habits is exactly what causes the heart to weaken over time. In this article, I will share with you 8 familiar foods, but ones considered the biological support system for the aging heart. These are not strange or hard-to-find items, but rather fish, yogurt, nuts, beans, chicken breast, tempeh, tofu, ingredients that, when properly incorporated into your diet, can help improve blood pressure, lower bad cholesterol, stabilize heart rhythms, and slow the degeneration of heart muscle. And especially, the 8th food will surprise many people, as it typically only appears in vegetarian diets. But it's a silent hero for cardiovascular health, thanks to its ability to improve microcirculation, reduce inflammation, and provide beneficial bacteria for both the heart and the vascular system. If you've passed the age of 60 or are caring for a loved one in this stage of life, this article will be an indispensable guide. And if you find this content important, don't forget to follow and subscribe to the channel so you don't miss the next part, where we'll begin with the first food, fatty fish, the strongest source of omega-3 to reduce blood vessel inflammation and silently combat atherosclerosis, especially types like salmon, sardines, mackerel, herring, and tuna. These fish are not only delicious and easy to prepare, but also rich in omega-3, an essential fatty acid that helps the heart function smoothly, rhythmically, and with endurance. Many people mistakenly believe that all fats are harmful, but in reality, the fats found in fatty fish are what help reduce bad blood fats, triglycerides, soften blood vessel walls, reduce endothelial inflammation, and prevent the formation of atherosclerotic plaques. Among them, 2 key fatty acids, EPA and DHA, are natural biological weapons that the body cannot produce on its own. They must be obtained from food sources like fish. According to the U.S. National Institutes of Health, NIH, EPA and DHA play a pivotal role in regulating heart rhythm, preventing arrhythmias, and protecting the endothelium from microdamage. A diet lacking EPA/DHA over time can cause the heart to operate under biological stress, leading to chronic fatigue and increasing the risk of heart failure. I once met a man in his 70s who had no major underlying health conditions, but frequently felt deeply fatigued after eating, even when meals were balanced and nutritious. After reviewing his diet, I found he had barely eaten any fish for nearly 4 months, avoiding it due to its smell and thinking chicken was enough. After adding salmon to his meals twice a week, within just 3 weeks, he began sleeping more soundly, had a steadier heartbeat, and notably felt less breathless when changing positions. If you can't eat fish regularly, supplementing omega-3 through fish oil capsules is also a viable option, though you should consult your doctor before doing so. Either way, the important thing is this: don't let your heart go without this precious biological oil. something your body needs more than ever after the age of 60. After discussing fatty fish, an excellent source of omega-3 for the heart, we now come to a food that seems simple, but has the ability to stabilize the heart from within: non-fat or low-fat Greek yogurt. Many older adults are afraid of dairy, thinking it causes weight gain or raises cholesterol. But the truth is, if you choose the right kind, especially non-fat Greek yogurt, it's an incredibly heart-supportive food, light, easy to eat, and packed with calcium, magnesium, and potassium, three essential minerals that help lower blood pressure and regulate heart rhythm. A diet rich in potassium and magnesium helps blood vessels expand more flexibly, thereby reducing the risk of high blood pressure, a key factor leading to heart failure and stroke in older adults. Especially when you consume yogurt daily, you're not only getting minerals, but also introducing beneficial probiotics into your body, helping stabilize digestion, reduce systemic inflammation, and in turn, support a healthier heart day by day. A 150 g serving of Greek yogurt can contain up to 17 g of protein, significantly more than regular yogurt, helping to nourish the heart muscle and enhance overall endurance for seniors, especially those who eat little meat or show signs of muscle loss after age 60. Many people have complained that they feel their heart pounding after meals or experience prolonged fatigue in the afternoon, without realizing their diet is severely lacking in magnesium and potassium. One serving of the right yogurt at the right time might just be what your heart has been waiting for. For those not used to eating in the morning, Greek yogurt can be the perfect snack 3 to 4 hours after a main meal or as a light dessert before bedtime. Just one small change, repeated regularly, is enough for you to feel a heart beating more steadily, gently, and calmly. If you're looking for a food that's affordable, easy to eat, and helps your heart grow stronger every day, then legumes are the perfect candidate that many often overlook. Black beans, red beans, lentils, mung beans. Not only are they common ingredients in everyday meals, but they are also a rich source of plant-based protein, soluble fiber, potassium, magnesium, and a variety of heart-friendly compounds. No need for complexity, just a bowl of lentil soup at lunch or a light mung bean porridge in the evening, and your heart will receive another layer of natural protection. Many think good protein only comes from meat or fish, but 1 cup of cooked beans can contain up to 15 g of plant-based protein, enough to support heart muscle recovery and maintain steady contractions. But the most outstanding feature of legumes lies in their soluble fiber, the kind that helps sweep out bad cholesterol from the blood, lowers blood pressure, and maintains ideal blood viscosity, thereby reducing the strain on the heart with every beat. I once advised a 65-year-old woman who always ate very little carbs, cut out rice to stay slim, and mostly ate lean meat. However, her blood tests showed high cholesterol and elevated markers of endothelial inflammation. We adjusted her diet by replacing half of her white rice portion with a mix of red beans, lentils, and brown rice, eaten 3 to 4 times per week. After 2 months, not only did she feel less fatigued after meals, but her lab results also showed significant improvement. Additionally, beans are a natural source of potassium and magnesium, 2 minerals that help stabilize heart rhythm, reduce the risk of vascular spasms, and improve blood vessel endurance. The great thing is that beans can be used flexibly in soups, porridges, salads, or stews, easy to digest and suitable for the taste of older adults. Sometimes, what helps your heart grow stronger isn't found at the pharmacy, but right there in a fragrant pot of soft beans, seemingly simple, yet full of nutritional power. After age 60, one of the most important yet often overlooked biological changes is the gradual loss of muscle mass, including the heart muscle. And to protect the heart from biological wear, supplementing with high-quality protein is essential. This is where chicken breast, a natural source of lean protein, plays a crucial role. Chicken breast provides a generous amount of protein, about 26 g per 100 g of cooked meat, while being very low in saturated fat, a factor that can increase bad cholesterol and the risk of atherosclerosis. Protein from chicken breast not only helps maintain the structure of the heart muscle, but also aids in the repair of muscle cells after thousands of contractions each day. But that's not all. Chicken breast is also a rich source of vitamin B12 and zinc, two nutrients that play a key role in regulating homocysteine, an amino acid in the blood. When homocysteine levels are high, which is common in older adults, it can damage the endothelial lining of blood vessels, leading to a higher risk of stroke, heart attack, and arterial stiffness. A notable point is that the vitamin B12 in chicken is more easily absorbed than from plant sources, which is particularly important because B12 absorption significantly decreases with age. Additionally, zinc supports immune function and the repair of microdamage in the heart and vascular walls. Choosing chicken breast in your weekly meals is a smart way to provide lean protein, reduce unhealthy fats, and support the biochemical processes that protect the cardiovascular system. Steamed, boiled, oil-free grilled, or shredded into salad, all are gentle preparation methods suitable for older adults. On the journey to keeping your heart healthy after 60, chicken breast is not just a source of protein. It's the foundation that ensures each heartbeat is properly nourished. And now, imagine your blood vessels like the plumbing in a house over 60 years old. If you pour thick, residue-filled substances into them daily, the pipes will corrode, clog, and eventually leak. But if you use just the right drops of good oil, those pipes are not only cleaned, but also flow smoothly. For the heart, small seeds are exactly those biological drops of oil. Chia seeds, flax seeds, and pumpkin seeds. They may sound simple, but they contain an incredible nutritional ecosystem. From plant-based omega-3s, ELA, which fight inflammation and soften blood vessels, to soluble fiber, which helps reduce cholesterol and stabilize blood sugar. They're like tiny cleanup workers, silently sweeping your blood vessels clean after each meal. A small spoonful of ground flaxseed sprinkled over your morning oatmeal can make a huge biological difference. Because with just a small amount, you're delivering monounsaturated and polyunsaturated fats into your body, fats that help raise good cholesterol, HDL, and lower bad cholesterol, LDL, exactly what your heart after 60 longs for. Moreover, seeds are rich in minerals like magnesium, zinc, and selenium, three key elements that regulate heartbeat, control cardiac contractions, and reduce oxidative stress. You can imagine that each time you eat a small handful of seeds, you're sending tiny energy stones into your bloodstream, helping your heart feel less shaky, less fatigued in the quiet afternoons of aging. What's special about seeds is that they don't make you feel heavy, don't spike blood sugar suddenly, and are easy to integrate into meals. Mix into salads, add to porridge, or snack on instead of sweets. They are both food and a gentle preventive medicine, no prescription needed. For the heart after 60, sometimes you don't need much, just the right nutrition at the right time, and seeds are one of those magical nutritional touchpoints. If you've ever thought of tofu as just a vegetarian's food, or something light but not filling, then perhaps after turning 60, it's time to see tofu through a different lens, a silent protector of the heart. Tofu is made from coagulated soy milk, rich in complete plant-based protein, containing all essential amino acids, a rarity among plant foods. This means each soft white cube of tofu is not only gentle on the digestive system, but strong enough to nourish the heart muscle and provide the foundation for muscle cells to function with endurance. But that's not all. Tofu also contains isoflavones, plant compounds with strong anti-inflammatory and antioxidant properties. Isoflavones help reduce endothelial inflammation, prevent atherosclerosis, and support gentle hormonal balance in older adults, something the heart needs more than ever when entering a natural decline phase. Additionally, tofu contains ALA, a plant-based omega-3 fatty acid that helps reduce triglycerides, lower blood pressure, and improve heart rhythm. The fats in tofu don't lead to visceral fat or raise cholesterol. On the contrary, they help the heart run smoothly during contraction and blood circulation. Many people think tofu is lacking because it feels light, but that very lightness is a great advantage for those with slower digestion, weak teeth, or a sensitive stomach. And when prepared correctly, steamed, gently braised, added to soup, or lightly stewed, tofu becomes a dish that is tasty, friendly, and heart-safe. Tofu is not a side dish. For the heart after 60, it's the main course, a thoughtful nutritional companion, low-key but steadily reinforcing strength every day. When it comes to heart-healthy nutrition, nuts are a group of biologically valuable foods often underestimated due to being mistaken for snack food. However, medical studies show that adding nuts to the weekly diet can have significant effects in reducing the risk of cardiovascular disease, especially for those over 60. Nuts such as walnuts, almonds, pecans, cashews, and peanuts are rich in unsaturated fats, particularly alpha-linolenic acid, HLA, a plant-based omega-3 that reduces inflammation, stabilizes heart rhythm, and improves blood vessel structure. In addition, they help lower LDL, bad, cholesterol, raise HDL, good, cholesterol, and maintain stable blood pressure. One study showed that eating nuts twice a week can reduce the risk of coronary artery disease and major cardiovascular events by 13 to 23%. In particular, walnuts are rated as having the highest omega-3 content among nuts, while almonds stand out for their vitamin E, a powerful antioxidant that protects blood vessel walls from free radical damage. In addition to healthy fats, nuts also provide plant-based protein, fiber, magnesium, zinc, and selenium, all of which play a role in controlling blood lipids, improving circulation, and supporting the heart muscle. Older adults who eat little meat or have poor digestion can use nuts as an effective nutritional supplement. However, they should be consumed in moderation, about 28-30 g per serving, to avoid excess energy intake. Prioritize unsalted, non-fried varieties to maximize heart health benefits. Incorporating nuts into snacks or mixing them into main dishes is a simple yet effective way to add heart-supportive nutrients, helping prevent heart failure and coronary complications in older adults. And you may have never heard of this name. Or if you have, you may have dismissed it, thinking tempeh is just a food for vegetarians. Mistake. A serious one. Because tempeh, a fermented soy product from Indonesia, is one of the most scientifically proven heart-friendly foods available. What makes it special is the combination of three key factors: high-quality plant protein, probiotics, and natural vasodilating compounds. In just 100 g of cooked tempeh, there are up to 17 g of protein, enough to provide energy and maintain heart muscle mass in older adults. Not only that, as a fermented food, tempeh contains a high amount of probiotics and prebiotics, two elements that help balance gut microbiota, which is closely related to cardiovascular health through inflammation control, cholesterol metabolism, and blood pressure regulation. The most surprising point: tempeh is rich in manganese, a rarely mentioned mineral that helps dilate blood vessels, improve circulation, and reduce the pressure required for the heart to pump blood, meaning the heart works less, but more efficiently. Unlike other soy-based dishes, tempeh is easier to digest, causes less bloating, and retains nearly all the beneficial micronutrients from soybeans due to the fermentation process. And if you think it's hard to eat, something only found on vegetarian menus, then know this. In the U.S., tempeh is being used in DASH diets to combat high blood pressure and in cardiac rehabilitation programs after stroke. That's no coincidence. It's the result of numerous studies on the link between gut bacteria, endothelial inflammation, and heart health. Tempeh sits right in the middle of that chain. Quiet, Uncommon, but effective and irreplaceable. If you're missing out on tempeh, you may be overlooking a silent lever that helps your heart function more lightly, more sustainably. Maybe you've heard of all these foods before. Maybe you've even eaten them, just without knowing they're the silent support system for your heart. From omega-3, rich fatty fish, which fight inflammation and reduce triglycerides, to low-fat Greek yogurt, which balances blood pressure with magnesium and potassium. From legumes, which cleanse cholesterol through soluble fiber, to chicken breast, which provides lean protein and stabilizes homocysteine. Then to seeds, a source of good fats and plant-based omega-3. To tofu, rich in antioxidant isoflavones. To nuts, with unsaturated fats and vitamin E. And finally, tempeh, surprise powerhouse that enhances circulation and vascular endurance through the gut microbiome. These are not medications, but for those over 60, they are the nutrients that keep the heart alive in the most literal sense.